Today, the Republicans in Congress tried to repeal health care reform, and I'm not going to mince words about these little fucktards. So, what I'm going to do is I'm going to clear up what this bill actually does. Here's what that horrible, horrible Obamacare actually does. Insurance companies can't deny you because of pre existing conditions. Insurance companies cannot rescind your coverage when you get sick. If you have cancer, the insurance company can't say, oh, you're not making us any money anymore, so bye-bye. They can't do that anymore. Kids can stay on their parents' health insurance plans until they're 26. 1.2 trillion is saved from the deficit every 20 years. So all those claims that, somehow this is actually going to hurt the deficit are a bunch of bullshit. It actually saves us money. Community health care centers, usually offered to people who can't afford health insurance, got the biggest amount of funding they've ever gotten. Insurance companies won't be able to cap your annual coverage, meaning like how it is now is some people who are really sick, after they've accumulated, let's say, $15,000 in medical expenses, the insurance company says, sorry, we're not helping you anymore. Insurance companies will no longer be able to set lifetime limits for coverage, so not only a year, but lifetime. States will be allowed to adopt single-payer healthcare systems. This is a part of the bill that nobody really not understands, but really doesn't look at. It allows single-payer healthcare systems in states. Do I expect states to do that? Not really, but it's in the bill. Women will no longer be discriminated against by health insurance companies, like pregnancy being a pre-existing condition. Medicare fraud will be cut down because there will be a task force dedicated to it, and that helps us pay for this bill. Medicaid will be expanded to people above the poverty line by, I think it's like 170%, meaning a lot of people will qualify for Medicaid, which is basically government subsidized insurance for people who can't afford it. Cobra and SHIP will be more affordable and longer lasting. Those are two state-run health insurance plans that are to needy people, and they're kind of a pain in the ass how they are now. They have a bunch of restrictions placed on how long you can be on them, and it removes those. And here's the one that people really don't like about this bill. All Americans will be required to buy insurance or they will be fined. There will be subsidies to cover the costs, and there will be waivers for people who just simply can't do it. There will be high-risk pools available in states, meaning people who just can't get coverage as it is now can go into these high-risk pools and get coverage. By 2014, there will be a health insurance exchange where companies will actually have to compete with each other in order to, and I forgot what I was saying. They'll have to compete with each other, meaning that they will drive down costs because competition drives down costs. It's one of the things about capitalism that actually works. And you'll be able to shop around for your plan and not have it forced on you. Per an executive order, the Hyde Amendment is strengthened, so no federal funds will go to abortion. Now there's a law and an executive order. I'm not too happy about that, but it might appease some right-wingers. So, I guess it's federal funds. That's not too bad. States will get help paying for Medicaid, meaning a lot of states are in the red for their budgets right now. And they will get extra funding from the federal government to pay for Medicaid, which will really help these states with hard economic situations. And last but not least, medical records will be easily accessible, and they will cost less because they're going to be digitized, and this saves us a tremendous amount of money, and it's more efficient. And another cool thing that the healthcare law does is it eliminates the donut hole, which is, it's pretty complicated to explain, but people on Medicare basically have to waste a shit ton of money to get their coverage, and they're going to get that money returned to them because it's a really crappy system. And we have George W. Bush to thank for that with his Medicare expansion, which, by the way, cost this country more than Obama's healthcare plan. So if you want to look at healthcare plans that cost this country, you have to look at George Bush's healthcare plan because it sucks and it's cost us way too much money. Another cool thing the healthcare bill does is it cuts down these subsidies. We actually hand out subsidies to health insurance companies, which is fucking evil, if you want my opinion. We give them a bunch of money like they didn't have enough already. And then last but not least, what the bill does is it puts a certain percentage of, it's 85% of money of profit that a insurance company gets in, they have to spend on care. They can't spend it all on quote-unquote overhead costs, which basically is excuses for healthcare executives to shower themselves in dollar bills. But what really gets me about this whole thing is the fact that the healthcare law is really a Republican bill. It's not a liberal piece of legislation, even slightly. And there's a history of Republicans being for exactly what's in this bill. In 1912, Theodore Roosevelt put forth a single-payer system option, which is infinitely more liberal than the current plan. And then in the 1970s, Richard Nixon worked with Ted Kennedy to form a healthcare reform that was very similar to this, only it also had an employee mandate. So it was a little bit more, Richard Nixon's healthcare plan was a little bit more liberal than Obama's. Then in 1993, when Bill and Hillary Clinton were trying to reform healthcare, Republicans in the Congress actually put forth a plan, which they didn't this time. The plan was exactly what just got passed. Even the mandate. Senator Chuck Grassley, Orrin Hatch, and there was a third one whose name is escaping me at the moment. Oh well, but these Republicans put forth basically the same plan, and they now claim they're against that buying mandate, but they said that was the only way it could work because all these new regulations would cost insurance companies and they needed new customers to make up for it. So those were their words. And that was just 1994. And actually, Bob Dole, the Republican candidate for president in 1996, campaigned on that plan. The same exact bill that is currently passed by Obama with no Republican support. And that expansion of Medicaid I mentioned earlier, that was also suggested by a Republican. It was Olympia Snowe, Republican senator from Maine, and she voted against it. Raising the Medicare payroll tax on the wealthiest Americans was suggested by John McCain, which that didn't even make it into the bill because it was deemed too liberal. And it was proposed by John McCain when he ran for president. The Medicare fraud provisions were put in there by Senator Tom Coburn, Republican from Oklahoma. And Mitt Romney also passed literally everything that's in Obamacare. So you've got a potential 2012 candidate who basically his claim to fame was it. And then last but not least, there's the public option. a government plan that will compete with the private sector and keep it honest. That was suggested by Rick Santorum, former Republican majority leader of the Senate. It was also backed by Republican Arnold Schwarzenegger. So, are you beginning to see that this is really a conservative bill? It's incredibly conservative. But Republicans, they claim that this is socialism, even though they were literally for it a decade ago. And they literally passed the bill to repeal it. It's not going to go anywhere because of the Senate and the president, but they were literally for this plan. In fact, they did a pledge to America in the 2010 midterms that said what they'll do to healthcare was eliminate pre-existing conditions, allow insurance companies to compete, and there was a third thing. Expanding plans to the needy. Those were the central tenets, and rescission of coverage, covering that. They just described basically roughly a third of what the dreaded Obamacare did. So they're just talking out of their ass, which is kind of to be expected if you're a conservative politician in the United States. But I think what's missing from this debate is really it's almost focused entirely on the financial cost of healthcare, and it shouldn't be. 45,000 people die every single year because they don't have health insurance. 45,000. Just think about that number. Think about 9/11, where 3,000 people died. 45,000 every single year because they lack health insurance. They lack a fucking card in their wallet, and they die because of it. And we consider ourselves a moral nation. 1.7 million people are dead since Richard Nixon's healthcare HMO policy. And we still want to talk about this as a financial issue. It's a moral issue. And guess what? If Republicans are against this bill, if Democrats are against this bill, if anybody is against this healthcare law, and they've previously been for it and they're playing politics, they have no fucking soul. And if anybody wants to debate me on that, I'm more than happy to. But I just wanted to clear this up, this crazy bullshit from the right wing about healthcare. But this video is getting long, so I'm out.